Welcome to KPOV's Critical Conversations podcast, dedicated to featuring unique perspectives, challenging mundane thought, and questioning the norm. Listen at kpov.org, on YouTube, or on your favorite podcast app.
And now we get to jump into a conversation with our wonderful guest today, Mike Macy. Mike is a licensed massage therapist living in Bend, specializing in craniosacral therapy and distance healing. He moved to Bend from Alaska, where he worked in the pain clinic at the U.S. Air Force Hospital in Anchorage. His book, Body-Wise, Manual Therapy is Our Ticket Out of Illness, Injuries, and Pain, was published in 2022. Regular readers of The Source Weekly may remember Mike's monthly columns on the mind-body connection. Mike, welcome to The Point.
Thank you very much. It's great to be here.
It's great to have you here, Mike. I am really excited to hear about your work. I've definitely heard of the term craniosacral, but I don't actually know a whole lot about it. So, Mike, what is craniosacral therapy? It's an extremely gentle form of manual therapy or body work. It's usually hands-on, but not always. We had to get creative during COVID. I guess so.
So the craniosacral therapy is based on the craniosacral system, which is a physiological system of the body, like the cardiovascular system. It has specific tissues and components. The craniosacral system consists of the membranes that line the brain and the spinal cord, the cerebral spinal fluid that's inside that container, and the structures that at the blood-brain barrier that filter out the red blood cells, pick up the oxygen, and then and deliver it to all the brain cells. And then the structures that reabsorb the spent craniosacral fluid and debris from the metabolic processes in the brain and toxins, etc.
Wow, sounds like a complex system occurring there. So, as your work as a therapist, what are you doing to stimulate and work with the system, and how does that benefit individuals?
Well, what we're doing is listening with our hands to the movements of the craniosacral system, which is basically the expansion and contraction of all the bones of the head, and assessing the strength, quality, amplitude, and rate of that. It's basically the cranial rhythm. And then if it's not up to par, or it's not moving somewhere, then we work to free that up.
Okay, wonderful. So it sounds like the craniosacral system is very important. And then what is cerebrospinal fluid that you mentioned?
Well, cerebrospinal fluid, we've all heard of the blood-brain barrier, which isn't sort of a single barrier, but it's occurs where the capillaries that go in, arterial capillaries in the brain, we're just trying to make sure that all that stuff is flowing properly, moving along.
Yeah, absolutely. And how would somebody know if that's an issue for them, if that's not occurring? Because if that's an important process, I imagine that when it's not happening, that people are feeling significant symptoms of that?
That's right. So, we know when there's a problem in the body by various symptoms, and pain being one of the biggest. And so if someone comes to us with pain or some other physical complaint, we do a hands-on assessment to try to figure out what's working in the body and what's not. And we work through the whole body. Obviously, craniosacral focuses on optimizing the operating conditions inside the central nervous system, the spine, and the brain, but it's a whole body modality. We're looking everywhere in the body, because you could have a problem. Say you could have vertigo, where someone's dizzy, has a very hard time standing up or whatever, but that could be coming from an ankle, where an old ankle injury, because everything in the body is connected to everything else by fascia, which is connective tissue, and it's elastic, and it communicates mechanically tension from every cell in the body to every other cell.
How did you get into this work, Mike? What drew you to specifically craniosacral work?
Well, the short story is that I was driving in my car one day, and I had just been out for a nice walk, and I said to myself, "Oh, she was so unhappy. Why was I married to her?" And 40 seconds later, my car had to stop. I stopped the car because there was a pavement eater out grinding up all the ruts in the road from the studded snow tires over the winter. And I looked in my rear view mirror and saw a little pickup truck sailing into me at about 50 miles an hour. So I always tell people, do not ask those type of questions when you're operating equipment or driving a car. Those are for the counselor's couch or bodywork session massage table.
I don't think many of us are able to keep those thoughts separate from driving thoughts. It's hard not to have those things pop up.
Yeah.
Was there an accident that occurred?
Oh, yeah. I was rear-ended at about 50 miles an hour, and I got whiplash. And that sent me to a chiropractor, a massage therapist, and an acupressure therapist who was just getting into craniosacral therapy. And I found that if I went to the acupressure guy first, then the massage therapist could actually get somewhere. Otherwise, my muscles were just rock hard tight. So one thing led to another. I started taking acupressure classes, and then I had a couple of astounding little experiences getting craniosacral therapy, and I went, oh, this is what I want to do when I grow up. So I still haven't grown up, but I'm doing it.
You're doing it. You made it happen. That's fantastic. And do you enjoy your work?
Oh, I love it. It's incredibly rewarding. And when I am helping someone, I'm creating a safe space for them to do their work, and I get to hang out in that space. So it's almost as good as getting the work myself, and I always tell my patients it's never clear who gets the best end of the deal. I mean, I know who gets paid for the session, but it's wonderful. Yeah,
everyone's benefiting.
Yes.
Fantastic. And so does craniosacral therapy, is it just about optimizing conditions inside the brain and spinal cord?
Not at all. It's a whole body modality, and the way that happens is that cerebral spinal fluid is created in pulses of about 8 to 12 cycles a minute, and when in the creation phase, the whole body widens and shortens, and then during the reabsorption phase, when projections shut off, the whole body narrows and lengthens. So you kind of got a conservation of mass going on there. And so we can feel that motion is most palpable and strongest in the head, cranium, and at the tailbone, the sacrum. But it's palpable throughout the whole body. So if there's a place where the rhythm is shut off, say at the knee, or is weak, say it on one leg compared to the other, then we know there's a problem there, and we go to work. What
all is craniosacral therapy good for? I know you've shared a lot about it, but tell us a little more about why do people try craniosacral as opposed to, let's say somebody got in some sort of an accident, they need physical therapy. How would they know to seek out craniosacral therapy?
Well, frequently people come to us after they've tried everything else and haven't gotten total satisfaction or haven't gotten rid of their pain or their symptom or complaint. We treat everything pretty much. And so, for example, immune problems. If someone has COVID, like a friend in India has COVID, I can help her with that over the phone or the computer. And behavioral or cognitive problems like ADD, ADHD. In fact, Craniosacral Therapist was one of its first applications was to help children with autism that were in basically back in the day, they were just, a lot of them were warehoused. And people just assumed there was nothing that you could do to help them. If you know, people with autism are very sensitive to touch. So that tells you how light craniosacral, the touch is, and craniosacral therapy is. When the creator of craniosacral therapy first went to treat those kids, they would all hide under the table, but all he had to do was just touch an ankle or a toe, and he could stop their cranial rhythm. That would allow things to reset, and then when it came back on, they'd feel better. And so pretty soon, when he came to the door once a week or whatever his schedule was, they'd all run to go, me first, me first, me first. So that was a very early indication that this was an important modality that could help a lot of people.
How wonderful that it's been discovered and is utilized now and can help so many people.
Mm-hmm. We do a lot of work with digestive problems, even vascular problems, heart, energy problems, liver, kidneys. There's very few things that craniosacral therapy can't dramatically improve. Cancer is probably one of them, but we can help cancer patients. We don't cure disease, but we help the body let go of stuff that's not helpful and move forward and heal.
Can it help with sleep issues at all? Because everything you're describing sounds like the system of the body working more efficiently and effectively, which I imagine could help with sleep.
Well, I'd like to say always, but my wife would disagree. But but definitely. So the sleep is, whether sleep is being disturbed because we're stuck in fight or flight, and if that's what's going on, we can fix that or help someone change that in just a few minutes. Or if it's a circadian rhythm issue, there may be a structure in the brain that's doesn't have adequate space or room, adequate cerebral spinal fluid supply, or adequate energy. So we can go to that particular structure and ask it how it's doing and try to improve its situation. So, yeah. Right. Sleep is another issue that we can help with.
We need that. People struggle with their sleep, and they're always looking for solutions. So I'm going to keep that in mind because I'm a mental health therapist, and people are always asking. Right. Sleep is a struggle for many people,
and sleep,
looking for new ways.
Sleep is integral to mental health.
Yes.
If you don't sleep well, all the systems of the body suffer, including the mind.
Yes, absolutely. Now, Mike, I think that craniosacral therapy can also be used to address emotional and even spiritual challenges. Could you tell us about that?
Well, sure. So this gets right to the body-mind connection. And so anytime a person experiences an emotional or spiritual overload, the brain automatically dumps that energy or emotion in the tissue somewhere in the body. So, so it's like a needle in a haystack. And this is all done instantaneously without any conscious awareness. So, and the reason the brain does this is because our whole body is organized for survival. So, if we're busy or we got up on the wrong side of the bed and we don't have to deal with the insult from our coworker or our housemate or whomever, there it goes in the tissue. And then it starts, we're not aware that it's there, but it's kind of broadcasting like a Mexican radio station at 50,000 watts saying, Houston, we have a problem. And so there's various ways of finding that. Usually often the cranial rhythm will be shut off or right at where that tissue or where that content, afflictive emotion is parked. And it's not necessarily that it was such a big deal at the time. It's just that it's circumstantial. We just didn't have the freedom to address it at the time. So the brain dumps it in our tissue, and there it sits, creating havoc slowly. At first, maybe 30 or 40 years before any sort of serious pathology shows up. But eventually, it will cause a symptom, and that's where we come in. And it won't show up on any imaging techniques. No X-rays, CAT scans, MRIs will show that there's somebody's anger parked in your knee. But it's there, and it's like the little grain of sand in the oyster shell. So that's why it's so much. One of the reasons this work is so much fun is to find that. And then the question is, well, do you need it any longer? And usually the answer is no. And often, and the person lets it go, and things normalize. And, yeah.
Beautiful. It sounds like such a wonderful addition to many of the other modalities that can really help people to release energy, stored emotions, mental blocks that again, as you said, the mind-body connection, it's all one. So ways that we can find to sort of sort that out and help people to rid themselves of these ailments is wonderful.
It's just great to be able to help someone when the body is not stupid and doesn't do things for a reason. So rather than medicating a problem or cutting it out, especially when you can't see it, it's nice to have some other options. It's kind of like a Etch-a-Sketch. If you remember when you were little, you get a doodle on a little pad and you don't like it, and so you just lift the Mylar sheet and off it goes.
Yeah, beautiful. Well, Mike, thank you for sharing with us about craniosacral, but you also wrote the book on it. You wrote Body Wise, Manual Therapy is Our Ticket Out of Illness, Injuries, and Pain. Can you tell us about your book?
Well, of course. So there are a lot of textbooks for practitioners on craniosacral therapy and other modalities. This is the first book that... And there's also books with a lot of anecdotes of wild stories from the clinic. But this is the first book that sort of, I wanted to demystify it. And so it's the first book that sort of explains these subtle motions in the body and mechanical motions and how important they are to our health. And then having done that, the book goes into the body-mind connection and sort of demystifies that, explains how afflictive content gets parked in our tissue and why, which we just talked about. And then there's quite an extensive discussion of why people don't get well. Resistance in your world is the word for that. I've been in practice for almost 35 years, so there's something like 44 stories from the clinic that sort of illustrate all this. the book it's in its second edition, and I think eventually it'll be picked up by the people that teach craniosacral workshops all over the world and visceral manipulation, and republished. So I'm very happy with how it came out. Yeah.
Congratulations on that, Mike. And thank you for your work and for bringing that out into the world and sharing that information. Because again, these things are so important. The more options that people have, the more ways to heal themselves, to find greater peace and function in their body and mind is so important. So Mike, thank you so much for sharing your wisdom with us. Thank you for being a guest on the show today. Mike, if people would like to find you or find your book, is there a specific way to do so?
Well, the book is Body Wise. It's the short title, and my name is Mike Macy, and it's available on Amazon, I think barnesandnoble.com as well. So it's fairly easy to find, and it's in both hardback and soft cover.
Fantastic, Mike. Well, thank you again for joining us.
Thank you for listening to KPOV's Critical Conversations podcast. To hear weekly interviews on important topics, please visit kpov.org/criticalconversations and follow KPOV High Desert Community Radio on Facebook, YouTube, and your favorite podcast app.